breast cancer, what are we talking about? We're basically talking about unorganized cell growth in the breast. Right. What would put someone at risk for getting breast cancer? We're looking at your exposure to estrogen. Like what we mentioned, that estrogen causes growth in terms of cells, of breast cells. So your exposure to estrogen. But naturally, you're exposed to estrogen. Generally, normally everyone has got estrogen in their bodies. But as females, we've got more estrogen as compared to males. That's why you find that breast cancer is actually much more prevalent in females. So in as much as every female has got hormones, there are certain factors that make us predisposed to get breast cancer. So what are we talking about? We're looking at how much estrogen you're exposed to in your lifetime. So that is things like having an early period, your first period. If your first period is before 12 years of age, you're at risk. But being at risk doesn't mean you're going to get cancer. No, it just puts you on the lookout. You understand? And then having a baby late means you've been going for periods for a long time. So definitely you've got more estrogen exposure. And then as much as also having a few babies, it also puts you at risk of having breast cancer. Then we also look at things like genetic defects. So genetic defects, we're looking at certain known genes, like what you call the BRCA1 and BRCA2 gene mutations. So those ones, they predispose you as well to getting breast cancer. Then if in your family there's someone who's had breast cancer, you should also be on the lookout for breast cancer in yourself, because that also puts you at risk of getting breast cancer. Then we've got other cancers that can be associated, that usually come along with breast cancer. So let's say in a family, if someone has got things like ovarian cancer, that's cancer of the ovaries in the females. If you've got thyroid cancer, that also puts you at risk of getting breast cancer as well. So then also talk about like nowadays, in terms of our diet, people are taking high-calorie diets, high-fat diets. That also puts you at risk of getting breast cancer. Then we also look at obesity. Generally, if you've got a high BMI, obesity, that's also associated with a high-calorie, high-fat intake as well. So that also puts you at risk of getting breast cancer as well. So this is an awareness month. We want people to know what to expect, what to look out for. If you're saying you are going to be screening yourself for breast cancer, if you're going to be on the lookout for breast cancer, what are you looking at? So basically, we say as soon as you reach about the age of 18, you should do what we call self-palpation. So self-palpation, you're basically feeling your breast for any lumps, any new developments in your breast. So this you usually do every month. And then as you grow older, for women below 40 years of age, we recommend that you actually get a scan done for your breasts every year. And then above 40, we recommend that you actually get a mammogram. The difference being, when you are below 40, you've got a lot of fat tissue. So a mammogram would not be ideal because it's difficult to compress the breast on a mammogram to really see inside. So for below 40, we would recommend that you actually get a scan done, an ultrasound scan for your breast to screen for cancer. And then for above 40, we recommend a mammogram. So what are the signs that you're looking out for when you're screening for breast cancer? So basically, well, you know yourself. You know that this is me. So if you see any new lumps, if you're looking at the breast itself, so let's start from outside going inside. So if you look at there's that black area, the dark area, it's called the areolar region. So if you see changes like in terms of color of that area, you should be on the lookout for breast cancer. If you see any nipple discharge, which is abnormal, if you're not breastfeeding, any nipple discharge, it's abnormal, you should be on the lookout for breast cancer. Then if you see any skin changes, like what I said, if you see any changes in terms of color, is the color changed? And then sometimes you can get pimples around the skin of the breast. Sometimes you can get the lumps, you can get swelling around. And then because the breast is from the chest, it's around the chest, and then it also proceeds to your axilla here. So sometimes you can even feel a lump inside your axilla. That can also be a sign that things are not well. Sometimes your breast might actually be normal, but you can just develop swelling of the arm. The reason being your breast has got what we call lymphatic drainage. So lymphatic drainage of the breast goes all the way to the axilla. So sometimes the lymph nodes in the axilla might be the ones which are actually affected. And when they are affected, you get swelling of the arm. But whereas your breast is okay. So for that, you need to get screening. But at the same time, when we talk about awareness, it's not just being aware about cancer on its own. It's also about assisting those who have been diagnosed with breast cancer and supporting them. In as much as cancer is a bit stigmatized in our society, generally worldwide, basically the diagnosis of breast cancer doesn't mean that someone is going to die. The earlier you catch breast cancer, the higher your survival rate. The earlier you intervene, the higher your survival rate. So with breast cancer awareness, we also want to support those who have been diagnosed with the disease so that they're able to go through the journey of treatment. Because treatment is not just a one-day thing, it can even take up to months for us to achieve remission. So it's also about supporting those who have been living with breast cancer, those who have been diagnosed with breast cancer, and those who are going through the process of treatment. So treatment is not a one blanket fits all. Like we said, the purpose of screening is to catch the disease early. So treatment will depend on, we have what we call staging. So we're looking at how bad is your breast cancer at the time that you are diagnosed. So we've got stages. So the better your stage, from stage 1 to 4. So if you're stage 1, your chances of your treatment will differ from someone with a stage 4 disease. So depending on treatment, we've got treatment options such as surgery. So surgery is where we're just removing. It includes options like removing the affected breast. Then we've got chemotherapy and radiotherapy. So this chemotherapy and radiotherapy, they usually go in conjunction with surgery. So after removing the bulk of the tumor, we use radiotherapy to actually make it remit. Then in terms of herbal medicines, nothing has really been proven to say that this cures breast cancer. There are some certain cancers which are more pronounced when you've got when you're HIV positive. The reason being, HIV causes you to have an immune suppression, so that regulation of cell growth is also compromised. So you've got certain cancers like cervical cancer that become more prominent when you've got HIV, when you're HIV positive. But it doesn't mean that everyone who's HIV positive will get cervical cancer. But it's not all cancers that are linked to HIV. It's just certain cancers.